I've spent 26 years in medical social work and have learned a lot from people who have told me their stories and shared both their challenges and triumphs. And so I'm happy to share this with you today and let you know some of the things that you've taught me and that I'd like to pass on and hopefully reinforce with you in terms of what you're already doing well. So normally I like to do presentations where we can chat back and forth, but because this is being live streamed, it's going to be a little bit one way right now. But please know that there are cards on your table and you can write questions down and one of the moderators will pass them along. Or if you feel that you want to just speak it out loud, I'll just repeat the question. How's that sound? All right. So let's begin. The topic today is around managing difficult emotions and down days. And as you know, having to deal with cancer means that it changed everything. As much as you want things to be normal or like they used to be, it's sort of like you can't not be pregnant. It changes everything. And you move forward and you try to figure out the best way to get through it. And as we know, we can't ever really go back. We can only go forward. I often use the adage that evolution doesn't move backwards, it only moves forward. And so the opportunity today is for you to discover ways that you have found a way to move forward. And maybe some of the things that I bring today will remind you of what those are or allow you to learn more about other ways to think about this. So when we're having to face such difficult life challenges, in the midst of it all, we're trying to get a lot of answers. But we also are trying to maintain some quality of life with this new normal. And it has to do with how we're doing in all of these areas: physical, psychological, social, spiritual, emotional, all of it. So these are some things that we have to think about if we're finding quality of life or trying to get back to a sense of feeling better about our lives in the midst of it and managing all of those emotions that come along the way, because they're all there. All of the emotions that we can humanly experience come with cancer. And that's hard to imagine sometimes because we think of it always as very frightening and overwhelming. But I would imagine that all of you have still had moments where you've had joy and delight and you've felt some relief and support along the way. So let's see if we can move toward more of that. Here we are in terms of managing challenges about something that happened that was very unexpected. Most of us don't think of ourselves as ever getting sick in the future. When we have people around us who get sick, we sometimes think, gosh, what would I do if that were me? But then when it actually happens to us, it really is a very different experience than what we might have thought that it would be. So we have certain expectations about what our life should be like, and then when it changes, we have disappointments or discouragements, or we just feel really angry about it. It can be a number of things. And what I've discovered, at least in my own life, and you might have noticed it in yours as well, is that how we actually manage those disappointments and those expectations really have a lot to do with how we then settle into the sense of, okay, I still got this, I can figure this out, and we are able to manage whatever is in front of us. It's times when we're really pushing against what is that we have the most difficulty and the most intense emotions that we have a hard time managing. Does that make sense? So the sense of when we can accept more of what is and be able to step into, okay, now what do I do with this? We have a better sense of well-being. So there is a book that I read years ago called The Precious Present, and there's a line in there that struck me that simply says, pain is simply the difference between what is and what I want it to be. When I accept what is, I have less pain. And that is so true in terms of how we face challenges, especially around managing cancer or any major disappointment or upset in our lives. So in this presentation, we're not only going to think about how we feel, but we're also going to notice how we feel about what we think. As you can imagine, there's a great connection between our thinking and our feeling. And it's really quite powerful, and most of us take it for granted. So when you imagine a certain experience, or you think back at a certain experience, you have certain feelings about it, right? But what we often don't notice is sort of the meaning that we gave it, the story that we're telling, the words that we use, the language that we use, and how powerful that can be, whether we tell ourselves, this is absolutely awful, I can't stand it, we have one feeling, or we can say, wow, this is really hard, I'm scared, but I'm going to find what I need to get through it. I'm going to surround myself with the people and the information I need. And there's a different sense of hope, a different sense of what it even feels like physically. One of the things to keep in mind is your body doesn't know the difference between a real or imagined thought. So how you imagine or how you think about something, your body automatically responds to whatever that means. An example I often give to people is, imagine what it's like to bite into a very tart lemon. And if you take a moment and really sit with that, for a lot of people, they do what? They salivate, or they might pucker a little bit. And there's nowhere does your body say to you, well, that's silly, there's no lemon here. It just does what it knows to do whenever you bite into a lemon, whether it's really there or not. You also know this when you anticipate a really good meal or another experience that's really uplifting. Just thinking about it changes how your body feels and how you feel. So what is it that we can then do to restore that sense of feeling good when we're not feeling good, whether it's physically or emotionally? We were talking about then, how do we notice what we say to ourselves, and then what do we feel as a result, or vice versa? So what we know is it's very, very closely related. So what can we do about any of it? A lot of times we feel a very strong emotion, and the next thing we know is that we're just reacting to that emotion. We're perpetuating whatever that feels like. And we don't notice what it is we either said to ourselves right before it, or what we can say in the middle of it that helps us calm down or helps us find a sense of emotional groundedness again. So ultimately, we all want to be happy. Right? We want that sense of contentment. We want to know that our lives are still good, there's something worthwhile, and that we are still able to do the things that we enjoy to the best of our ability. So I like this little schematic because it tells us that we have choices along the way, right? So are you happy? Yes. Keep doing what you're doing. Are you happy? No. Do you want to be happy? Yes. Then change something. If you don't want to be happy, and there are some people who are seemingly perfectly content with just being pretty miserable and having a sense of what they want to complain about and feel quite justified in doing that for long periods of time. That's not to say that we don't ever have moments where we're angry and frustrated and we have things that we want to complain about, but how long we spend there, that's our choice. That's where we get to decide, okay, when is enough? Have I said enough? Have I dealt with this enough? Now am I ready to move to something else? So having said that, I wanted to draw your attention to a publication I just stumbled upon. And I have it with me today, and I would really encourage you, if you're interested in this, is to pick it up, take a look at it, because there's some wonderful articles about the research on happiness. Who knew we were studying that? But I think it's wonderful. Instead of what's making people miserable and what seems to be associated with disease or sadness or depression, now they're actually saying what actually makes people stronger? What helps them get through difficult times? How do you determine who's going to get through this issue, whether it's dealing with cancer or some other kinds of change in their life that they didn't want or like at all? How is it that some people seem to get through it with a better quality of life and maintain a higher level of happiness and contentment than those that don't? And so we've learned a lot. We don't know everything, but we're learning more than we did before about what the connections are, what makes a difference in terms of how we think and how we respond to any type of life challenge. And the important part about it is that we really get to pay attention. Now that we have something we can identify that is in us that we actually can control. So a lot of life is about what you can't control, right? And then it's a matter of deciding, what do you want to do with it? So I, again, learn a lot, and my teachers are all of you and many others who have sat in chairs similar to you in your doctor's office or in these rooms or in any support group, is to find out, what is it you're thinking, what are you telling yourself, and what really matters in terms of how do we take this thing that's so hard, this experience, and move beyond it, move through it, not ignore it, but actually find our strength and our courage to do what's next. So what we learned is that we have constant stories that go on in our mind in terms of how we give this meaning. And we tell ourselves that we assume what the information is we're thinking is true, right? Every time you have a thought, you don't say, gosh, I wonder if that's true. We just think it, and then we act on it often, right? Well, the whole idea, my hope at least for this, is that you begin to allow some space between what you're feeling and what you're thinking, and just noticing what that language is. What's that story that's going on inside? Because that's the part, that's your point of control in this moment of noticing that language and then paying attention to it and deciding, is that what I want to keep thinking? Is it even really true? What else do I need to know? What other perspectives should I consider? And then move into the next step of noticing that if I think differently, could I have a different experience? And that's what we believe is very possible, is that as we learn to get more information, learn to notice our thoughts, choose new ways of considering or thinking about things, we actually can have a better experience. Have you had that already? Have you noticed that in terms of times when you've been really overwhelmed and you sort of found yourself thinking the same really worrisome thought, and someone came forward and offered another way of thinking about it, another language or words to use, another perspective, and you went, oh, that actually feels better if I consider that or think that way. And so now it's going to be a matter for you to decide whether you want to keep doing that or not. Remember, you have the choice of you keep doing what you've been doing or you learn something new. And part of what is amazing is that we actually can learn resilience. Some people have said, well, that's just how I am. That's how I do it. And they don't want to consider, or they're not willing to consider another way to think about something or doing something. They're kind of stuck in that that's who I am, and they don't trust that there might be another way to get through their experience or even think about it. And the idea of resilience means you get to practice it by doing new things. We've learned a lot about our brain in the sense that we have this thing called neuroplasticity. Have you heard that term before? Which basically says the way we've always done things doesn't necessarily mean that it's completely hardwired and you can never change it. What we do know is when we keep practicing a behavior or a thought pattern over and over and over again, it creates sort of a superhighway in our brain that when we have a certain kind of trigger, we go right to that kind of behavior or reaction or thought or feeling, right? What we also know then is there are alternate routes that we can set up. So when we have a certain trigger that happens in our life and we know our tendency is to sort of go in one direction, when we allow a little bit of space where we go, oh, there's that tendency again, that's how I used to do it, I'm going to try something different. I remember somebody saying that maybe exercise might be good or talking to someone might be good. I'm going to try that. I have a list of things I can look at. And then the more we try that new behavior, that new way of thinking, we create another superhighway. We create a detour around what that first reaction might have been that we've practiced for a long time. So it doesn't happen overnight, but with a concerted effort, we can actually learn behaviors that make us more resilient. So here we are in terms of understanding this association between how we think and how we feel. And it has to do a lot in terms of, remember, our quality of life. We're trying to get to a quality of life we actually enjoy and that we appreciate. So let's take some time today to think about the quality of our thoughts, whether we want to keep thinking the way we're thinking, or if we might want to change something or consider a new way, a new perspective. So regardless of what your spiritual or religious beliefs might be, there are certain themes that you'll notice that come across from people of great inspiration. This last quote by Buddha is really pretty powerful in terms of recognizing how you think and how you feel, and then what you create or you experience. So you're creating your experience all the time from this moment on. And do you know that you're also teaching people how to treat you? By what you allow. So depending on the people that you surround yourself with and how they think and behave, that's contagious, as you are in terms of influencing others that you're close to or spend a lot of time with. So here we are now at a crossroads where you get to really think about how you want to create your experience from this point forward in terms of your thoughts, your feelings, and your behavior. So these may be many of the thoughts and feelings that you've had before. It's not uncommon to feel angry and frustrated when you get a diagnosis of cancer, feeling very worried about what does this mean for me, not getting enough sleep, wanting to say, no, this isn't really happening. I can't believe it. I've done all the right things in my life, and if people do all the right things in their life, only good things happen. So you can sort of see where that can become a very faulty trap, right? Is that bad things still happen to good people, and good things still happen to people we might consider bad, right? So it's a sense of how do I shift the way I think about it so that I'm not so stuck in that feeling. Obviously, depression and fear are very real. Guilt. For many people who are dealing with lung cancer, I hear they feel so bad that they thought they've created it, and that they should have done something differently. This is not a time where that serves us anymore. Whether we have lifestyle behaviors that we might relate to a certain illness or not, once that illness arrives, and it can be a variety of reasons, because there are a lot of people who smoke and don't get cancer. There are people who don't smoke and get cancer, and it's quite a variety. So now is a matter of then what do we do with that? How are we kind to ourselves that we can forgive ourselves and be able to move beyond that guilt? And know that now we're going to face this in a way that we can manage it in a more healthy way, and we can make new choices along the way. And then the sense of hope. How do we still maintain hope at the face of times where it feels like everything is against us and we haven't got many choices? There's a powerful story that I heard from a woman who was facing the end of her life, and she actually was very involved in hospice and palliative care. And she chronologically followed her experience through a video as a documentary. And there was a point where she made this statement, and it's always stuck with me, and I pass it along often. She said, through all of this, it's not that I lost hope, it's that my hope changed. At the very beginning when I got my diagnosis, I hoped that they would be able to cure it. I hoped that they could manage it. I hoped that I wouldn't have much pain or discomfort. And I hoped that I would have people around me that knew what they were doing and were skilled and thoughtful and could help me. And then as her disease progressed, she had pancreatic cancer. She realized that hoping for a cure was not realistic or possible for her. And she made the realization that her hope was changed. She didn't lose hope. But now she hoped that she would be comfortable. She hoped that she would be able to say all the things that were important to the people that were important to her. She hoped that she had left a legacy. She hoped that she wouldn't have much discomfort. All of those things were a new hope. It's not that she lost hope, but it was a new hope, and it changed for her. And I want to offer that to you too, whatever it is you're facing, that when you feel hopeless, remember that you have the option to just change the things that you hope for. So loneliness. Interestingly, a lot of people can be very lonely, even in a large group of people around them, because they feel so closed off and there are things that they don't think that they can say out loud. So I'm hoping as we go forward in terms of as you learn to think about your thoughts and your feelings and how you manage them, is that you will allow yourself to tell your story. That you don't have to keep it all inside, so you don't have to experience loneliness in the midst of it. I think the fact that you're here today and that you have allowed yourself to be exposed to new information and be with other people who are facing some of the same challenges, that you also have the opportunity to relieve some of that loneliness in the midst of all of it. And the relief of knowing there's new science all the time. There are very skilled people who are working very hard to help you have a better quality of life, help you manage this disease, and they're not giving up. There are people all across the world who are researching different aspects of what it's like to get cancer, manage cancer, control cancer, as well as how do we, as helping professionals, help you manage it better. What works, what doesn't? How are we available to you in ways that really are relevant, that matter? And then the sadness, that is something that we can't escape. Anything in life that we truly care about, when it changes and changes in ways that we don't necessarily want, we're going to feel some sadness and some grief about that. So how do we manage that as well and be able to acknowledge it, get the support we need, and move through it?
So I've heard people talk about regret. Is that, would you put regret under any of those categories, or it's separate?
So he was, this gentleman was asking about regret in terms of those feelings. Definitely. So the regret in terms of what we either didn't do or did do, asking for forgiveness, having a sense of trusting that we did the best we could with what we knew at that time. And that's so true for us is with regard to, again, we can't go back and change things, but we can change our relationship to it. So when we have regret, it's a matter of what is that internal messaging, that meaning that we're giving it, as far as is it something that we can forgive ourselves for, that we can forgive others for, or ask forgiveness for. And so it's a matter of, again, knowing what are we telling ourselves that's leading to that sense of regret. Does that answer your question? Okay. So grieving is very normal. And when we have so many losses and changes in our life, we're always noticing what that experience is. And sometimes we just need that time to be sad, to say what we're sad about, to acknowledge what we've lost, and have some time to actually heal that, ask for support around that, and being able to talk about what it is. And then recognize also, along the way, what are the gifts that are still available? What's still possible for us? So it's a matter of noticing what's changed, but also being able to notice what's still available to us, who's still available to us, and finding out what remains, rather than only thinking about what's lost. So we allow ourselves time for all of those emotions and acknowledging it and being able to have a witness, someone to hear the story rather than holding it inside of ourselves. Again, having social support and being able to tell the story, talk about it, is so important in being able to manage a lot of these emotions. Because when we hold it on inside, that story inside, the language doesn't change. It just ruminates, right? But when we get to say it outside, we sort of hear ourselves and notice, wow, that really sounds awful, or it sounds like maybe I'm thinking too much about something that is not actually correct or accurate, and maybe I need more information. And then hearing other people respond to us, both to acknowledge our pain and our struggle, as well as offer support and perhaps other ideas to take in and think about. And as you know, other people in our lives who care about us grieve that loss too. So they're in it with us, and that's why inviting them, allowing them to be part of this experience is again so important. A lot of times when I'm dealing with couples or families, they will say to me, well, I'm afraid to let my loved one, so this will be the patient speaking, I'm afraid to let them know how I really feel about this, that I'm scared, or that I want to do something different than they want me to do, because I don't want to upset them. I don't want to be more of a burden to them. And on the other side, I'll hear the family members say the same thing. And yet they're doing it separately. They're not sharing their thoughts with each other. And so they try to maintain this facade that everything is just fine, when inside they really are struggling with some pretty big questions. And the irony is the other things that the other person doesn't know, but when you know each other well enough, you pick up on that, don't you? You know something's amiss. This is especially powerful to keep in mind for children. There are some people who don't want to tell their children what's going on, but children are so perceptive. They know something's amiss. And I'll just offer this little piece about children, is what they don't know, they make up. And this is actually true in our human experience. In the absence of good information, we make stuff up. So for children, though, they have the disadvantage of thinking that they actually caused something to happen when something looks like it's out of balance. And they don't understand then what to do with that. So being able to talk with children in an age-appropriate manner about what's going on is really helpful in reducing their anxiety, more so than not telling them. So I'll just throw this out with regard to anger and frustration. So there's a great deal of emphasis on maintaining a positive mental attitude, right? With regard to never getting angry, never letting your frustration show, and always acting as if everything's just fine. I had a period of my professional and personal life in which I was involved in Al-Anon. And there was a very crude acronym for FINE, which FINE stood for, you know, when people say, I'm just fine, and they're saying it through gritted teeth, is I'll change the wording a little bit, but fouled up, inadequate, neurotic, and emotionally unstable. Right? So the more we hold that in, again, the more it really builds up steam. So having some ways that are appropriate outlets are really important. And in fact, I just read some research that having an outburst of anger releases the same level of hormones as sex. In terms of that release, those endorphins that actually afterwards we go, yeah, that felt pretty good. So it's not that we get to use the anger in a destructive way, but knowing it has its place. And this particular research, I think, certainly shows that, if ever you've been in a difficult or a painful situation. So you don't have to pretend that everything is fine. You're allowed all of your emotions. And if there are times where you're angry, frustrated, scared, sad, whatever it is, find someone that you can talk to about that, where you get to say it. And if you are in a supportive role, tell whoever you're with who is dealing with a hard time that you're willing to sit there with them and that you can handle it. Because a lot of times we think, gosh, if I'm really angry with somebody, they can't handle it. Well, find somebody who can. Find somebody who can, because you need to unleash that. You need to relieve yourself of that so that you can move on and also begin to work through it, whatever is behind it. So as we know, anger and frustration, if we don't like something the way it is, it moves us to act. We get to choose something else or get more information or ask for more, expect more. It can reveal our fears. I often find, and you probably have heard this, that the louder and angrier a person is actually reveals that they're really quite afraid of something. Have you ever thought about that? Times when you're really angry. Any of you in here parents? Okay. So here's an example. Do you ever have a child that is running toward the street or a dangerous situation and you grab them and pull them back and your first reaction is anger? Don't you do that? And you're shaking him and say, do you realize how dangerous that is? And you really are coming from a place where it looks like anger, but what's really behind it? You're afraid. You're afraid for them. And this is one of the things that all of us who work with all of you have to keep in mind, that when you come into the clinic or your doctor's office or you're meeting someone on the street and you're just mad, is we have to remember that you might be afraid about something, that there's something else behind it that's actually driving that irritability. And then our role is to try to figure out what that is. Because sometimes when we're in that intense emotion for ourselves, we don't know what that is. We just know that we feel angry, and we haven't been able to peel back that layer that says, wow, I'm really afraid about something. But in our culture, it's easier and it's more acceptable to be angry in some cases. I mean, look at our political climate. It's really pretty powerful in terms of how the anger and frustration is coming out. But what's happening is a lot of people are really afraid. They're worried for themselves. They're worried for their future. So having said all that, I just want to remind you it's never okay to harm yourself or others just because you're angry. We know it has its place. It's a normal feeling to have. But what you do with it really is important, how you manage that in a healthy, supportive way. So we talked a little bit about living with uncertainty and this whole idea of control. And it has to do with whether or not we feel like we are finding those pockets of control that we can actually get to, right? That we have some capacity, some mastery. And then there's also this other part of ourselves that we know we live in a certain amount of mystery. We don't predict the future very well. And we don't have a sense of always having knowledge of everything we're going to need when we get to a future event. So we have some sense of trying to balance how we get to do both. How we get to have questions and how we get to live with the questions. How we get to have answers and sometimes we have to wait for the answers. You know this especially when you're waiting for results of scans or results of certain blood tests. Did the treatment work? Did it make a difference? And it's a sense of how do you then handle this moment now? So some of you may be familiar with this prayer. Have you ever heard it before? It's quite powerful in the sense of really delineating this whole question. Because it says that what we want is to have some peace with whatever is going on, right? We want to be able to settle in and have a sense of there's something we can do. And then we want to know when there's a part we know we can do, we want to know that we have the courage and capacity to do it. And then if there isn't anything to do, how do we sort of sit with that? And how do we live in the mystery and live with the questions? So we might say this prayer too, is how do we live in the meantime when the answers aren't readily available to us and we still find those moments where we can do what we can do. So the most common thing that we get ourselves in trouble with is thinking there's nothing we can do. So I'm here to tell you that there often is, and I would even risk saying there always is something you can do. Because regardless of what's happening around you that you don't have control of, you always have a choice and control about how you want to respond to it. And that's your point of power. So you can cope by being either avoidant or active. So when you're avoiding your pain and your difficulty or your challenge, you might deny that the problem exists. Denial, I will say, overall, isn't always a bad thing. We sometimes can only take in the reality in small pieces, and we have to deny certain parts of it or deny acknowledging it so we can sort of manage the enormity of it by taking it in pieces. We might withdraw. We might avoid the problem altogether and use coping through drugs and other unhealthy behavior. I worked with a woman who, when she was diagnosed with breast cancer, thought that it was okay for her to shoplift because her well-being had been taken away, and so she felt like she had the right to take whatever she could when she wanted to. Very bizarre association, but sometimes in our mind, if we're not checking out how we think and what meaning we're giving to things, we can sort of follow a trail of thought that isn't very good for us, that leads to unhealthy behavior that we think is justified. And then the whole idea of blaming ourselves. Some of that speaks to your question about regret. That if we're constantly blaming ourselves, or we have constant regrets that we didn't do things the way we should have, that doesn't help us in any way. And it's really hard to move forward and find a sense of well-being when our own internal language is being so punitive. So the idea is to be nice, be able to support who you are, and what you need at the time. So an active coping style might include accepting that the problem exists, taking action to really understand and manage the problem. Look for the advice and information you need to get through it. You don't have to do it alone. It often does require thinking about it in a new way. So having a sense of, is what I'm telling myself helping me or hurting me? What else do I need to consider? Whoops, let me go back. So all in all, it means making sure that you're making yourself available to the support that's out there for you, whether it's through friends or professionals or groups, allowing yourself to make that possible. So here are some of the things that you can do, and includes, again, reaching out, giving a hug, getting a hug. I often promote the idea of hug until your heart giggles, so that you allow yourself to really be with someone and be in that moment and appreciate it. Eat healthy. We all have heard about this. Exercise. There is a myriad of research studies coming out, and in fact, one of the other sessions today is about the benefits of exercise and how it actually changes our brain, changes our ability to manage life. Take a break, do things that feel good, surround yourself with people that feel good. Make a gratitude list. Have any of you heard about this as an activity? When we hold ourselves in a place of gratitude and compassion and appreciation, our whole physiology changes. In fact, there's this whole field of study called heart math, H-E-A-R-T, math, that has to do with how our brain waves and our heart energy actually becomes coherent and works together to support our well-being. And it's achieved by simply being grateful, loving, being in a compassionate frame of mind. So write down reasons. A lot of times when our thoughts start running in cycles, it's really hard to stop it until we start writing things down, and it slows down what we're telling ourselves. And we get exposure to what it is we are saying. So we get to look at that language and look at what meaning we're giving experiences and say, wow, is that really true, what I'm telling myself? And how do I challenge it? How do I find out what really would be more helpful? What is more true? Laugh. Sense of humor. I think there are so many opportunities through life where there really are funny things that are happening, but when we're so caught up in our worry and our anger or frustration or sadness, we miss it. So as much as you can make yourself available for those experiences, allow yourself to laugh at yourself and with others. That's powerful. In your packet, you'll see, and on the slides, you'll have more time to look at this in terms of what you can do. So putting together actually a list of what works for you. What helps you maintain a sense of well-being or restores your sense of well-being when you're not feeling so great. Where you get an opportunity to still have the feeling and work through it and then come out the other side with something to look forward to. So again, these feelings and thoughts, you might change the language that you use. You might change the strategy that you use. And I really like this slide in the sense that, You know, finding happiness in life is not one event, achieving one thing or several things. It's how we are so present in the moments that are good, that we enjoy, that we really notice them. And it's like putting beads on a necklace that says, oh yes, that's really mine. Now I can remember them and go back to them, and I can still have that good feeling. And when we string them all together, we say, yeah, you know, overall I had a pretty good life, or I have a pretty good life. And so a matter of really noticing and being present in those moments is really now popular in the mindfulness-based stress reduction classes that are being promoted and the research that's supporting them. So again, are you happy? And what do you want to do with that? If you're not happy, how do you want to find a way to get back to happiness? It doesn't mean you have to be happy all the time, but how do you find your way back? And then this is my thought for you and my hope for you, is that you feel loved and cared for today and every day, and that you're carried through difficult times, whatever your religious or spiritual belief. In this particular picture it says God, but whatever words you want to put in there where you feel supported, and that you're filled with peace, that you have those moments where you know it's really hard, but you have a way of coming back and still settling in peace. Thank you.